Hello students. Today we are going to discuss how to start with the NEET MDS preparation. Before that, let us discuss about the overview of the NEET MDS exam. The NEET MDS exam, that is also known as National Eligibility Cum Entrance Test for Master of Dental Surgery. It is a national level entrance exam that is conducted by NPE all over India. So what is the eligibility criteria for the NEET MDS exam? The candidates who are aspiring to pursue Master of Dental Surgery program, they must complete their Bachelor of Dental Surgery degree, and that might be registered with the Dental Council of India or the State Dental Council. Now what would be the eligibility criteria? So that is the number one, if you require a BDS degree, that must be registered with the Dental Council of India. Second, the candidates who are appearing for the NEET MDS exam must have completed their internship, a 12-month compulsory rotatory internship by 31st March of the year of the admission. The internship should be recognized again by the Dental Council of the India. So candidates should be registered with the Dental Council of India or State Dental Council. The provisional registration is acceptable provided it is submitted at the time of the counseling. The citizenship should be Indian, overseas or non-resident Indians and foreign national. They are eligible to apply for this exam. Now let us discuss the exam format. So what is the exam format? The mode of examination, the NEET MDS exam, it's a computer based, it is a computer mode exam conducted in a online format. So the candidates, they interface or they interact with the exam interface on a computer. The timing, the exam is typically scheduled annually and it takes place from, it is a 3 hours duration exam that is generally at 9 a.m. to 12. What are the type of questions? The exam consists of multiple choice questions where candidates need to choose the correct answer from the provided options. So it is a objective type question exam and total number of questions in the exam are 240. There are 240 multiple choice questions. So total marks, it is of 960 marks. So each question, it carries a 4 mark. The language, the question paper, it is available in the English language. The syllabus, so the question, they cover subjects and topics related to the dental and the medical science. The syllabus, it consists of all the medical and dental subjects taught during the Bachelor of Dental Surgery curriculum, spanning from first year to the final year. So each question is awarded with 4 mark, and suppose there is a negative and suppose you make an incorrect answer, then there would be a negative marking of -1 mark for each incorrect answer. The unanswered questions do not result in any mark. So important is that if you make a question incorrect, then -1 mark shall be deducted from the total score. Now the exam, remember that it consists of 2 parts, section A and section B. So in section A part you will get a total of 100 questions. That is, a section A consists of 400 marks. Each question carry a 4 marks, and section A is of 400 marks, and section B it is of 560 marks. So a total of 960 mark. So this is the scoring criteria. If you make answer correct, 4 marks are awarded, and if you make a wrong attempt, then 1 mark is deducted from the score. And if it is unanswered, then the mark is 0. Now let us discuss the question weightage. Well, part A consists of 100 questions. That includes subject general anatomy, including embryo and histology, where 14 questions they are asked. The physiology and biochemistry, they consist of 14 questions. Dental anatomy, embryology and oral histology again consist of 14 questions. The general pathology and microbiology, the weightage is 14 questions they are asked. From that, the pharmacology, again 14 questions. From general medicine, 15 questions. From general surgery, 15 questions. So these two subjects are important as they carry 15 questions in total. 15 questions will come from general medicine and 15 questions will come from subject general surgery. Now the part B, as we discussed, it consists of 140 questions. That is, it is of 560 marks. So 14 questions will come from dental material in part B. 14 questions come from oral pathology and oral microbiology. 14 from oral medicine radiology. From pedo, 14 questions. From ortho, 14 questions. Perio, 14 questions. Prostho, 14 questions. Conservative, again 14 questions. Oral surgery, 14 questions. Public health dentistry, 14 questions. So a grand total of 240 questions in total that would be asked in your NEET MDS exam. So from this point of view, you can see that the final year subject, they are the most important for the NEET MDS examination point of view. So this was all about the exam pattern type. So the exam is generally conducted in the morning session, that is from 9 a.m. to 12 a.m. So you have to go to the examination center, and the commencement of biometric registration, it starts at the 7 a.m. Almost the entry, the closing of entry at the NEET exam center, it occurs around at 8:30 a.m. After that, the no candidates, they are allowed to enter in the examination. The login access, it is given at 8:45 a.m. The candidate starts reading the instructions for the paper at 8:50 a.m. and the exam starts at 9 a.m. and it ends by 12 p.m. So this is all about the number of questions that are and the weightage of the questions that are asked in your NEET exam, and what would be the scoring criteria for this NEET MDS exam. Now let us discuss how do you start for your NEET MDS 24 preparation. So remember, what is the first step is what would be the time frame. So if you could not start during your final year of BDS, begin your preparation at least 10 months before the NEET MDS exam. So plan to dedicate around 10 to 12 months for completing the entire syllabus thoroughly. So create a study plan. You need to develop a well-structured study plan that will cover all the subjects and the topics systematically. Allocate the time for each subject based and on its weightage in the exam. As we have completely mentioned, the weightage of each subject and the number of questions that would be asked in your NEET MDS exam. Apart from that, you can use standard textbooks from your BDS curriculum for the references. So refer to the reference to the standard books. It is beneficial for deeper understanding of the concept. Apart from that, you can take advantage of online study materials, video lecture and learning platform. Join a test series program to enhance your understanding. Apart from that, you can practice regularly, solve MCQ regularly, and attempt mock test to assess your progress and identify your areas for the improvement. The most important is to maintain consistency. Be consistent. So maintain consistency in your preparation, avoid last minute cramming and focus on gradual and steady progress. Apart from that, you have to keep yourself informed about the latest exam pattern, changes and any updates that are related to the NEET MDS exam. So for that, you can join our app Goal MDS or join our WhatsApp group and be updated with all the latest news about the NEET MDS exam updates. Now certainly the trend in the NEET MDS PG exam questions, they have evolved over the years. In past, different questions were often framed from clinical books, books like Ritu Duggal, Prabhakar and VP Singh. However, in the recent exam, there has been a shift toward the clinical oriented questions. So these questions, they are designed to know the candidate's ability to apply the theoretical knowledge to the real life clinical scenarios. Like a question that generally the exam pattern has been totally changed, like a patient came to your clinic and you notice there is a dry socket following extraction of tooth. The reason of this is due to the options can be staphylococcus aureus infection, disintegration of the blood clots, prolonged antibiotic cover or unsutured socket. So this is what the newly framed questions, they are being asked, repeatedly asked in the NEET MDS exam. Apart from that, addition of image based questions adds another dimension to the examination. The number one is the image based question that have been added, and second is the clinical oriented questions. The exam pattern, it has been totally changed nowadays. So you have to begin solving MCQ immediately after completing the theory portion of a specific topic. So that will help you in applying the theoretical knowledge and identifying the areas that you need further clarification. The MCQs, mock test and previous year questions, they are essential component for your preparation. So the most important are the PYQs, that are the past year questions. At least you need to do at least last 5 years question to understand the exam pattern. So regular practice with MCQ help you to understand the NEET MDS exam pattern and type of the questions that are generally asked. Apart from that, you will understand the distribution of the topics and overall structure of the exam pattern. At least daily practice. If you are starting with the NEET MDS exam pattern, remember to practice around 200 to 250 MCQs every day. So So the regular MCQ practice, it helps to identify your weak areas. So areas where you consistently make mistake or face difficulty, that will need that will indicate the need for additional focus and revision. Apart from that, solving a significant number of MCQ daily, that will also help you to refine your time management skills. It prepares you for the time constraint of the actual exam, ensuring you can complete the paper within the stipulated time. So in a NEET MDS exam, remember that the revision, it plays an important role in retaining the information and ensuring success on the exam day. So remember, revision is the backbone for the NEET MDS exam preparation. The vast syllabus of the NEET MDS requires multiple revisions to ensure the retention of facts and figures. Regular revision would help you to solidify the information in your memory. The ultimate goal of revision is to be able to recall the information effortless on the exam day. Through consistent and thorough revision, you build a strong foundation for the efficient recall. So remember, you have to aim that you should at least complete the entire NEET MDS syllabus in 3 cycles. Each revision cycle may take around 1 to 3 months depending upon your performance and pace. So develop a habit of revising the notes and topics completed at end of each day. So this daily revision would help you to prevent the forgetfulness. Apart from that, re-attempt the questions. Incorporating the practice of re-attempting questions that were answered incorrectly in previous days, that is must. You must mark your incorrect answers and re-attempt them again and again. Now, what are the books that you will need for the NEET MDS preparation? Choosing the right study material is important for effective NEET MDS preparation. The first book that you would need is the Dental Pulse. The Dental Pulse, we know it's widely recognized and used by NEET MDS aspirants. It provides comprehensive coverage of the syllabus and includes the practice questions for better understanding. The second is the Dentist. Dentist by Dr. Gauri Shankar. It is known for its in-depth content and relevance to the NEET MDS exam. So remember, it is valuable source for building a strong foundation in the dental subject. The third book that you need is Neeraj Vadhavan. So Neeraj Vadhavan AIPG or NEET solved last year's 10-year paper that is a useful book for practicing the previous year questions, and it helps you to understand the exam pattern and familiarize yourself with the type of questions that are asked in the NEET exam. Apart from that, you can use this Target MDS image based book. Since the new pattern is that a lot of image based questions they are asked in your entrance exam, so you can either go through with the Dental Pulse or Target MDS image based book for those image based questions. Now, apart from that, what are the reference books that you need? For oral surgery, you can go through with the Peterson, the standard textbook, Keys and Case, Melamed, etc. For pedo subject, you can go through with the MC Donald, James Avery. For oral radiology, you can follow is White and Farrow. For oral pathology, you can follow is Neville, Sheffers. These are the standard textbooks. For perio subject, you can go with the Carranza. For the ortho subject, you can follow is the Graber. Profit. For pharmacology, you can follow is the KD Tripathi. For oral histology, you can follow is the DADH, you can follow is the Wheelers. For anatomy, you can follow is the Grays. For physiology, you can follow is the Guyton. For dental material, you can follow is the Anusavis, Craig. For pathology, you can follow is the Harsh Mohan. For microbiology, you can follow is the Nathanarayanan. For community dentistry, you can follow is the Soban Peter. For prosto, you can follow is the Boucher, Stewart, Rosensteel. For endo, you can follow is the Grossman, Engel, etc. So these are the books that you can follow, the standard textbooks that are required for your NEET MDS exam preparation.